Today I am joined by Professor Bejon Kumar Misra, Founder Director, Patient Safety and Access Initiative, and a consumer rights activist. Good morning, Mr. Misra, and thanks a lot for joining us.
Good morning. Good morning. Pragynesh, I somehow don't like the word activist. I try to not be an activist, but be a aware citizen, and that's my profile. Thank you
Yes,
for the lovely introduction, Pragynesh.
yes. So my first question to you would be, sir, the recent decision by the Gambian government to strictly monitor the drugs that are imported into the country from India after the deaths of children caused there by Indian pharma made in pharmaceuticals cough syrups. How has this dented India's image in the pharma world?
You see, India is considered today what countries speak or what the Gambian government has initiated. It doesn't disturb me at all, because India is known to be the hub of or the pharmacy of the world. We manufacture in terms of volume, we are almost exporting more than what we are consuming in the country. Our export is more than 50% of the total production of pharmaceutical products. So countries do accept Indian products, and they have their own protocol, because quality of drugs is highly dependent on the importing country to understand and monitor. So just giving a statement, it doesn't solve the issue. We have to go to the root cause, and the root cause is most of the importing countries, they compromise in terms of quality. They do not source their imports from reliable sources, which actually leads the country to import not of quality standard drugs into their country, and India becomes a victim for no reason, and it gets magnified by the competitors who are competing with India to magnify such incidents and throw to the world that India is the hub of not of quality standard medicines or spurious quality standards medicine. So, to answer your question, it's a very unfair way to picturize India in the global world, because we are known for manufacturing quality medicines at the most affordable price for the global consumers.
Even considering that the Gambian government did not have the proper mechanisms in place to check these medicines, and they actually don't have proper testing labs. These kind of incidents have also previously happened in India. Recently in Jammu Kashmir, children died because of cough syrups which contain DEG. So isn't there a problem at the regulatory level in India that these kind of medicines are available in the open market?
Yeah, you see, criminals are everywhere. Pragesh, you will agree with me that people who want to trade in counterfeits or spurious or not of quality products would always be crawling around in the supply chain. So if the supply chain is not insulated from such criminals, then such incidents would 100% happen and keep happening. And what I feel is that in the regulatory mechanism in India, instead of working like a fire brigade, only wakes up when there's an alarm, is not accepted. The regulatory oversight should be surveillance, regular checking, so that we reduce these kind of incidents to happen. But at the same time, I would tell you the kind of examples you quoted, they are very, very few. And we have conducted evidences and studies which shows that the percentage is minuscule. But as our former president of India, Dr. Abdul Kalam, once mentioned in one of our events, he said not a single drug, not a single medicine should be substandard or spurious or not of quality standard. And I fully agree with him and his thoughts. We should not allow even one medicine in the supply chain to be accessed by innocent patients and become victims of death or victims of serious ailments. So my contention is it is a serious issue. There has to be a mechanism where the center and the states work together based on certain modern technology to be used to ensure that such drugs are pulled out of the supply chain much before it reaches the end users. So my contention is there are ways of doing that. It's not a rocket science. We have done it in India. We are still doing it in India, and we have developed many software and mechanisms which should be put in place. Unfortunately, it is getting delayed in terms of implementation because the laws need to be amended. We are still carrying on with an ancient law which does not allow certain interventions to be done by the state government and the central government.
You mentioned about central government and state governments working together on this. CDSCO is a central regulatory authority, and at the end of the day, all these pharma companies, their initial tests are done by state regulatory authorities. Considering that even after cases of duplicate drugs being sold out, these companies are able to show that they have got these tested and that they have the required results. Would it be right to say that at the state level, there is a nexus between these pharma companies and regulators, which leads them to hand them over fake licensing agreements and allow them to produce duplicate products?
Pragynesh, when there is a puncture in the system, or you are not efficiently and effectively managing your regulatory oversight, which is deemed to be conducted as per law, then such incidents are bound to happen. I would not go to blame the state or the center. I would go to blame the processes and the systems adopted today, which are not user-friendly or which are not in the interest of the consumers. Because when such incidents get highlighted in the media, the consumers start suspecting on the supply chain, and then their kind of a trust factor gets reduced and undermined, and they start doubting that is there a nexus, is there some kind of vested interest working, are the criminals are having some kind of a heyday with the regulators. So these kind of questions do come, but to eradicate such thoughts, evidence-based mechanisms are the best. Everybody believes evidences. So we believe in, recalls. We believe in ensuring that before a medicine could reach my house or to the patient, they got recalled because they were found to be not of quality standard or spurious. And these are doable things which can be done. But we are not developing those mechanisms to build that trust. And let me tell you, in the year 2014-15, we conducted one of the world's largest study. Government of India spent 8.5 crores. There was a national survey done on the quality of drugs in the supply chain. And what did we find? Out of that 74,000 samples which got tested in accredited laboratories, in government approved laboratories, and in a proper manner, all the protocols, all the SOPs were followed. You should read that report. You all should make that report public, which was done by National Institute of Biologicals. If you Google search NIB National Drug Survey, you will get the whole report. You will get the recommendation in chapter 11 in terms of what was the summary of that report. And it's a very useful and rich document which is catching dust. We need to implement those recommendations. We need to change the laws. We need to change the system. So we cannot say it's a nexus. It's a inefficiency in the delivery system. It's an inefficiency in the regulatory system. So if you have good systems in place, no criminals can play a role. They will be exposed much before the poor consumers becomes victim to such kind of a nexus or such kind of an activity which you have described. In my view, we cannot blame the good players. There are good officials working in the state regulatory body very efficiently, very effectively. But when such incidents happen, their morale goes down. And their morale goes down because we are not implementing the regulatory system in the manner it should happen. So it is high time we implemented those recommendations which came out of that 8.5 crore public money being spent for such purpose, to bring in expert opinion on how to move. If they don't get implemented, and today we are in 2023, where we recommended that such studies should be conducted once in at least 2 years or 3 years, 4 years, so that we know that where the system is, where are the loopholes, how to plug those loopholes, how technology can be used. And we have developed softwares at pittance, at no cost, but we have developed it. But it is not getting used by the state governments, those softwares which we have created. So who do you blame? I would not blame a Nexus, but I will blame the regulatory authorities or the top management of the state and the center to ensure that they look at these kind of studies and implement them as soon as possible. We have delayed. The bus has left the bus stop.
So considering the fact that now we have such a decisive government at the center, which has been very active regarding drug regulations also, how far are we still from implementing these kind of reports, the finding of these reports, and even the Malshekar committee report, which recommended death penalty for company owners who are producing these kind of drugs?
Yeah, Mashalkar committee, I was there in 2002, 2004. I was representing the patients and the consumers in that committee. I still remember it was a very rich report. Dr. Mashalkar spent a lot of his time and expertise with the group where I was included. It was such an excellent kind of an exercise and a report generated, during the leadership of Sri Atal Bihari Vajpayee ji. I still recall very fondly where death penalty was the end goal, in terms of ensuring that such criminals cannot be spared who are playing with the lives of innocent citizens. So I still remember that, and those recommendations are yet to be implemented. Similarly, as I told you, when the present government came into force, the earlier government had recommended this study, but the present government went ahead with that recommendation and allotted 8.5 crores. So the present dispensation of the political system is very, very keen with this issue. And our Honorable Prime Minister, it is his top priority to ensure that safe medicines are provided to the citizens in the most affordable manner, like Jan Aushadhi he has started, for the poor, for the middle class, to access generic medicines branded by the government to be supplied to the citizens, assured in terms of quality. So there are a lot of good initiatives happening, but the trust factor has to be built. The present government, how do you expect the Honorable Prime Minister to know the conversation which we are having today? Till somebody doesn't share this video or this telecast with the Honorable Prime Minister. If you don't share those kind of findings which we have done out of public money, and he comes to know about it, he will not come to know. And I know the reasons why the government is shy to share such reports with the Honorable Prime Minister, because there are loopholes, there are lacunas which we need to plug. And then there is a delay in plugging those loopholes. And I'm sure the Prime Minister will come very heavily on the officials that why did you delay on such a recommendation which came out in 2016? And today it is the second term. We are looking at that leadership to ensure that we are able to fulfill those dreams which has been given to us by the Honorable Prime Minister, that India will be a safe place for every patient. We want to make sure quality prevails, and quality is paramount, and no compromise on not of quality standard medicine or spurious medicines to be found in the supply chain. We have to be very dedicated to ensure that it doesn't happen, and real heads should roll. In practice, it should roll. Pragynesh, you took me back to 2003, 2004, when our late health minister, Sushma Swaraj was the health minister, and I still remember she categorically mentioned that no compromise on such criminals. they should be given death penalty. The Mashalkar committee recommended that. But then it got diluted. It did not get implemented by the next government. So we are expecting the present government to come very strictly on these issues. We have given recommendations. It is nothing a rocket science now. It's been in a very simple language. The recommendations have been made where an ordinary citizen will understand how much time he spent in that core group, burning the midnight oil to churn out this report. But when we see such reports are catching dust, tears roll out from our eyes. We feel very disappointed that why did we spend so much of public money to do this activity when it did not attract the attention of the government for some reason where they find that it is showing certain negatives, but negatives are to be seen as suggestions for improvement. It should not be seen as a criticism to the government. You see, the present Prime Minister is always ready to listen, to look at good suggestions, good practices. He wants to be the number one in the world. Now, in order to become the number one in the world, you have to adopt the best practices. So the people who are around him should give him the truth, should make him privy to these such reports, which I am not sure whether he has been made privy or not. And I have a feeling he doesn't know about it. He doesn't know about it. It should be shared with him.
Thanks a lot for your time, Mr. Misra. It was a pleasure talking to you.
My pleasure too. Thank you for giving me this time and talking to me. Thank you very much, Pragynesh. God bless you. Take care.